Watering from the eyes after a stroke. Is it normal or is it something to worry about? Today I was prompted to make a video on this topic because of a question, rather a statement made by my father. Last month he suffered with a stroke, and recently he was telling me that he feels that after the stroke he has become more and more emotional. And for a minute I was taken aback that why do you think so? And he told me that whatever he is doing, whether he's having food or he's watching a TV show or he's talking to my mom or to the rest of the family members, he starts getting tears in his eyes, and they are so much that they are even shedding out. So he feels that he is crying because of emotions. But that's not it. Watery eyes may very well be a manifestation of the stroke itself. Stroke occurs when there is deprivation of oxygen and nutrients to a part of the brain. And how does it affect the eyes? The eyes, we know, are the organs of sight. They gather all the visual information from everywhere around us, and then they send this information to different parts of the brain, where the information is received, it is perceived, it is processed, and then we see the object. So this whole pathway of receiving the information and then seeing the object that we are viewing is called the visual pathway. And if the stroke affects any part of this visual pathway, then the eyes can have different manifestations. It can affect the nerves supplying the eyelids, it can affect the muscles of the eyelids and the eye, or it can affect the facial nerve. As a result of any one of these being affected, what happens is that the eyes, they start blinking slowly. Normally, the eyes are blinking about 15 to 20 times per minute, which means approximately 900 to 1200 times the eyes are blinking in a normal person in an hour. So when this process slows down due to a stroke, or the muscles of the eyelids are affected and the eyes do not close properly when a person is sleeping, it can cause overexposure of the cornea, corneal dryness, and this may lead to a gritty, uncomfortable sensation in the eye. And the eye compensates by producing more tears, which the person sees as having extra tears, watery eyes, and shedding tears all the time after a stroke. So this is what happened with my father too. So what can you do about it? If anyone in your family has suffered with a stroke and they are getting these symptoms, you need to contact, first of all, the neurologist to treat for the stroke and to assess it, and then you have to contact an ophthalmologist. He has to look into the eyes and he has to see how the stroke has affected the eye. If it is just watering due to extra dryness, then they may advise you some lubricant eye drops, the artificial tears that can be used, and some eye ointments that can be used at night if the muscles are laxed to keep the cornea from getting extra dry. Other than that, there may be other manifestations in the eye if the person has suffered from a stroke. One may suddenly wake up from a proper good night's sleep and feel that one of the eye has lost its vision. That may be due to a silent stroke. Then any part of the visual field may be affected. The person may not be able to see either the central portion or the upper half of the eye's visual field, or the lower half, or the inner parts, or the outer portions of the visual field may become unable to be seen. Then there may be blurring of vision. There may be double vision, diplopia, that you're seeing double objects. Then there may be extra movement in the eyeball. As a result, the images may be moving, which is nystagmus. Then there can be malalignment of the eyes due to the effect of the stroke on the eye muscles, which can result in strabismus. Other than that, the person may be able to see very normally, but the perception area of the brain is not working properly because of the stroke, and although they are receiving the image, but they are unable to make sense of what it is, which is known as visual neglect, also called visual agnosia or spatial insufficiency or inattention. So they may be, according to the area that is affected, the depth of the things or their movements, they may not be perceived very well, and the complaint may come that a person is banging into the sides of the table or into the furniture around in the room, and all this may be due to the stroke. So what can you do about it? You have to contact the eye doctor and the neurologist so they can guide you properly. Normally in daily life, watering occurs for normal infections, or there is some corneal abrasion, or there may be a foreign body in the eye, or there may be inward turning of the eyelids or outward turning of the eyelids. These commonly cause watering. But after a stroke, there may be other reasons. So you must get yourself checked. So stay healthy. Be aware. The point of sharing this little information is that you know when to contact the doctor and get yourself treated properly. Thank you and have a very nice day. Assalamu alaikum.